Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. Our, our number is 866-870-5752. Call us right now here in the studio, 866-870-5752. Shall we talk to Nick?
Yeah, Nick, thanks for calling. Dr. Marc Darrow. I'm going to give out the phone number one more time so we can get a bunch of lovely callers in here. The phone number to talk to me right now is 866-870-5752. And if you want to call the office, the number there is 800-300-9300. If you want to watch me doing videos of these procedures of regenerative medicine using platelets and stem cells, go direct to the website, which is www.jointrehab.com. That's jointrehab.com. And Nick, for calling in, we're going to send you a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's got about 250 studies that show how regenerative medicine works, why it works, how it's safe, and how surgery is on its way out for musculoskeletal pain unless you have some type of an emergency. So, Nick, I understand your hip and your knee bother you. How long has that been going on for?
Doctor, I've seen you about maybe a couple months ago.
Okay.
And you told me I had like the muscle that attaches to my pelvis. It was like compared to like a sprained ankle, and you weren't worried about it. I don't know if you remember me.
I don't remember you. I'm sorry, because I get lots of new people every day. But I can speak to what you're talking about. Tell us more.
Yeah, and I basically just been doing a lot of stretching and so forth, and it's worked out pretty good. You weren't too concerned, and I've been doing real good. Been feeling really good, and then I just came back yesterday from a road trip to Arizona in the car for 8 hours, going there and coming back. A lot of traffic.
All right.
And going there, my hips started hurting. I'm sitting in the passenger seat.
Okay.
I'm having to press my hip with both hands, making fists, trying to put pressure in the points where it was bothering me.
Sure.
By the time I got there, my knee is killing me now. Right around the knee bone.
Gotcha.
And it bugged me for a couple of days, and then we came back yesterday. Same thing. My knee is just like throbbing in pain, and now it's back in the hip as well.
Okay. Well, let me ask you a question. Do you want to come in Monday morning? Because I'll get you right in. I mean, we're booked. We're booked. If you,
I can't get on my horse. I'm at work and I'm hurt.
Oh, now I remember. You're the horse guy.
Yeah.
Will you tell? I'll tell you what. You've got my cell number, right?
Yes.
You can call me. You can text me, or you can tell me right now, and I'll get you in whenever you want.
Okay, because
we'll take a quick look.
Is it a nerve thing, or?
I don't think so. I don't think so.
Okay, because it's I've tried to. I purchased one of those guns that that can massage your various aching joints.
Yeah, I don't like those guns. I think they hurt people.
Really? Because
I see them all over. It's a big cultural hit right now. Everybody's got the gun.
Yeah, I use that.
But it's not massaging. It's kind of pounding, and some people like it. But a lot of people
it makes me feel real good.
Well, if it feels good, then do it. Yeah.
Oh yeah. I utilize that.
Yeah, my experience with it is it doesn't make me feel good. It actually pounds areas, and then it hurts afterwards. But I guess if the muscle's thick enough, you're fine. I'm a skinny guy, so it's banging on my bone. So do you have any questions about this, Nick?
Yeah, what I know you have to examine. I know when you touch and feel, you can pinpoint what it is exactly. But just what I'm explaining,
I
do you
can't
think
tell
it
you
is?
I can't tell you on the radio, Nick. I don't know. Um,
Yeah,
it sounds like it's the same kind of thing you had before, and
yeah,
uh, and you do ride horses, so people that ride horses get pain. It's part of the project.
yeah.
I take care of tons of people who train and ride horses. And the most amazing one was a woman who'd done this her whole life, and her own horse kicked her right on the side of her hip. And she came in with miserable, miserable pain, all black and blue, about maybe like 10 inches long and about 6 inches wide. And she'd been to the emergency room. They didn't do anything. And so she came in to see me. And I put my ultrasound unit on that area, and I saw fluid inside. So I asked her if I could put a needle in it and take the fluid out. And we got out about 100 cc's of blood.
Ooh,
And I don't know why the emergency room didn't do that. As soon as I took the fluid out, she was like, "Oh, God, thank you so much. That feels so good." And she healed right up. So, yeah, I've got to see people. I have to see you and touch you and use the ultrasound to look inside sometimes and figure out what's going on. I don't think anything terrible is going on. You didn't have a traumatic thing that you're talking about.
no,
Sitting in
I've
a,
been feeling really good. Just this ride,
yeah.
going and coming back.
I think it's just more of the same of what you had before when you came in to see me, whatever it was, 2 months ago or so.
Okay. And
Did
then I
I?
got one other question.
Sure,
I've
go
read
ahead.
something
Sorry.
about stem cell activator. What is that
Okay.
exactly? Do you know what that is?
Yeah, I think it's what we call BS.
Yeah, that's what I thought too. When I was reading and watching some infomercial on that, it didn't quite make sense.
Yeah, I've never had anyone take those things that have had any positive results. So there's a lot of supplements that I've taken. I haven't taken those, but typically when a patient comes in with something and they say it worked, then I will get it and try it on me. So I'm always the guinea pig. I'm the guinea pig with regenerative medicine. I've injected myself in terms of both my knees, my wrist, my elbows, my neck, back, shoulders, you name it. I've injected myself or had other people do areas I can't reach. And I've taken, oh my God, I don't know how many different supplements and different types of healing things that generally don't work on me. And then when people say, "Does this work?" I go, well, "I tried it, it didn't work on me, but it might work on you, so try it." And every once in a while, I'll find something that really does work, and then I tell people about that. So you should try it, see if you like it. I haven't tried that one, and I've never met someone who said they tried it and it helped. But I always say, if it's not going to hurt you, try it. Try everything.
Yeah.
Open your mind up. Science keeps changing. When people get locked into the science of today, they're in a troubled mind because it's going to change by tomorrow. So we got to keep our minds open and check things out and test and see what works. So if I were you, I would try it.
Okay. And I'm just wondering, I have this pain. It's really bothersome right now. Anything I can do just help me through the next couple of days?
Well, the typical thing is ice, right?
Okay.
You can do ice 20 minutes and then stop for another hour. Don't keep things iced for too long because it constricts the blood vessels. And in your situation, ice might be appropriate. If you had something traumatic, I would do heat because we'd want the blood cells to go there to bring fibroblasts, which are cells that actually heal the area. But if yours is just sitting in a car, you can try some ice or try some heat or alternate ice and heat. The RICE protocol is traditional medicine, which is rest, ice, elevation, and compression. I don't like that generally because I want blood flow to get there. I don't want to cut off the blood flow. But in something like this, you might try it, and it may be the answer. When you said you came in a couple of months ago, we just looked at your hip area, and I told you it was just a muscle strain. Then that went away.
Yeah,
But the knee, I don't know about your knee because I haven't touched it.
Yeah,
I'm guessing the hip area.
I've had a problem with the knee. It's
Yeah,
like
I'm guessing.
the pain went from the hip, and the hip was feeling fine, and it went directly to the knee.
Well, like I said, if you want to come in, you just text me. You've got my cell number. Every patient does.
Okay.
And I'll be glad to scoot you in anytime you want and take a quick peek.
Sounds good. And enjoy
I won't
the show.
charge you.
Thanks for taking my call.
Well, I appreciate it. Thanks so much, Nick. I appreciate your call, and thank you. It's good that you helped educate a lot of people.
Okay, thank you.
All right, so if you want to talk to me live right now, or as Dr. Jean, my ex-host, I love Dr. Jean, used to say, call in now, live and local. So the number here right now to talk to me is 866-870-5752, 866-870-5752. If you want to call the office, the number there is 800-300-9300. If you do call, we will send you a free copy of Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's got all the information on how these treatments of platelets and stem cells work, who it's good for, who it's not good for. There's about 250 studies on it. And I hear it all the time. Patients come and they go, I went to an orthopedic surgeon. They say this doesn't work, and it can't grow tissue, and blah, 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 blah. I don't know where they're coming from, because this is science today. You know, back in the day when I started doing it 25 or more years ago, it was an experiment for me. I used my body as the guinea pig, and I found out that it worked. The truth of it is, this type of medicine has been around since the beginning of time. Back in China 5,000 years ago, there's reports of using needles that they would heat up to stimulate collagen regeneration. And then back in the late 1800s, there was a surgeon in France named Perret that used it to cure hernias. I don't do that, by the way. I do sports hernias, but not inguinal hernias. And then in the 30s in Chicago, Gus Hemwell and I forget the other guy's name, did thousands of patients. George Hackett and Gus Hemwell did thousands of patients using the old prolotherapy style. And then it came back after they left the planet. It came back in the 80s and then got kind of popular. And now you can walk down any block and find a doctor who does regenerative medicine, platelets and stem cells. It's very prolific all around the world now, but be careful to have a doctor do it who does the most of it, who does it all day, every day. And don't go to your chiropractor to get it, because they're going to hire a doctor who doesn't know what they're doing. I love chiropractors. I don't like when they are having these dinners for elderly people and snookering them into spending a fortune to have this done. It shouldn't be an expensive procedure. You don't have to pay a lot of money to get someone good doing it. So I'm going to go to Isaac, who's got a knee pain problem. And this is Dr. Marc Darrow. Isaac, how are you today?
Hi, very good. I just quickly wanted to tell you my experience with prolotherapy. At the age of 67, I had a 2-year-old son who hit 25 pounds. And at that point, I could not carry him up the stairs. My own son, I was 67. I went to Kaiser. They did the knee x-rays and said, come back in 3-4 years, we'll do replacement knee. And with that behind me, I'm an old guy believing only in medicine, not alternative medicine. But I went to prolotherapy 1 week, got some injections. 2 weeks later, I go for my second treatment. All the pain, all gone. My son is 14 years old, 12 years of no pain because of your type of therapy.
Well, God bless you, Isaac. We all appreciate you letting us know about that. And that's been my experience on my own body and that of most of my patients. And I love my work. I can't tell you, Isaac, what it is like to be able to watch people heal. It's one of the greatest, I don't know, it's just fun. It's fun to do my work. And I love it, and I love that I'm doing it not just for my patients, but for me. I lucked into it because I'm a crazy athlete. And there's not a day that goes by that I don't do something that there's a chance of me hurting myself. And you're lucky. You just had a knee problem. I had both knees with meniscal tears and a giant amount of fluid in them. And they're all healed up now from me injecting myself. So God bless you. I want to go ahead. I'm sorry.
No, I just want to say I'm doubly lucky because I got a great wife and a great son. But I'll get off the line.
Yes, you
now.
do. All right, we're going to go
much.
to, thank you so much. We're going to go to D. D, it's Dr. Marc Darrow. Thank you so much for calling in. And I guess from what the call screener said, you had a hip replacement. Is that true?
Oh, no. I met a young lady. She's 32 or 3 years old, and she has had a hip replacement on the right side, and she was going in to have the left side. And I gave her some advice, and I took her phone number to call to check with you to see, because I told her, look, check into stem cell, and I'm calling you to find out is it good advice for her to look into stem cell therapy rather than a hip replacement? She's young.
Well, it's always smart in medicine to do the most conservative thing. What I do are simple injections. You walk in, get injected, and walk out. Surgery can be very problematic. I've seen people die on the operating table. I've had many people come with infections after they've had a surgery. I've seen things where one leg gets shorter than the other after a joint replacement, then other parts of the body start to hurt. And look, I'm not putting down surgeons. I love surgeons, but I wish they would not do most of these surgeries. I wish they would stick to the things that had to be done. Now, the person you met who is 32 who had a hip replacement already is going to have problems down the road because that's not going to last. Now, she may have really had to have had it done. I wasn't there. I don't know what her problem was. But most people that I meet who are opting for a joint replacement don't need to get a joint replacement. I get people in all the time who say their surgeon said they have to get a joint replacement. I move them around, I examine it, and I go, you don't need a joint replacement, and we do platelets or stem cells and heal them up. So, you said, is it good advice to check it out? It's good advice to check everything out. See what works for you. See what feels good in your gut. And I tell some patients who come and I go, I don't think you need surgery, but if you think you do and you want to do it, then that's what you should do. And I'll be waiting here if it doesn't work out.
I was trying to make sure that stem cell, whatever you do, there's a darn good chance, or it is a good therapy for a person who is in an auto accident who has had such an injury. Got it. That's quite all right. Won't take up any more of your time because I've got it. I'm going to call her right now and give her your phone number, your office number, okay? So thank you so much.
You're so sweet. Thank you so much.
Thanks
I appreciate it.
That's great.
And for those of you that don't know the office number, it's 800-300-9300. There's people by the phones. If the phones are busy, just leave your name and your phone number. They'll call you right back. And I'm going to give out the phone number again to the studio where you can talk to Nita and I. And that number is 866-870-5752. I'm Dr. Marc Darrow. I've been doing regenerative medicine with platelets and stem cells and other things for over 25 years. If you want to watch videos of these procedures that I've done, go to www.jointrehab.com. Joint, Joint, rehab.com. And you'll actually watch these procedures. See if it's something you want. It's sure a lot easier than getting a surgery. It's easy to walk in, get a shot, and walk out instead of going into the hospital or surgery center and having your body opened up with all kinds of potential side effects with it. Very, very few side effects from the work I get. Mainly like Amy, who called in first, said she was a little bit stiff. I injected her yesterday. I'm expecting by tonight that stiffness in her knee will be gone. Who knows? We'll see.
Sounds good.
So, Nita, what do you got to say for yourself?
Well, I just think that people need to call in, because if you're in pain, then, and you don't even call in, I mean, why sit day after day in pain, right?
Hey, Nita, why can't you hear a pterodactyl going to the bathroom?
I don't know.
Because the P is silent.
Ooh.
I'm going to get you one more before this next
Okay.
caller. Put on your thinking cap, Nita.
Okay.
What do you call a well-balanced horse?
Hoofy.
That's good. Stable.
Ah. Well, that's
All
the
right, you'll
building,
get
not the horse. That was misleading.
That's true.
I
I misled
object.
you.
Okay, that's okay.
This one I'm gonna lead
wait,
you.
Greg is ready. Let's go to
Wait,
Greg.
one more fast one, Greg. Stick with us. I'm having so much fun. Nita, you ready?
Ready.
Where do polar bears keep their money?
In their fur.
Close. In a snowbank.
Oh, well, it's probably better than other banks. Well, I won't go there.
That's good, Nita. I love that. Greg, you have a daughter with a slipped disc. I'm sorry to hear that. Tell me about it. How old is she?
She's 28, and
Okay.
she just it took a while to get into the doctor. It was trauma induced. She was on her gal's bachelorette thing, and she said, I wasn't horsing around, but I was on the bed, and the sheets slipped, and she said, I didn't even brace myself, Dad. I literally hit my chin on the floor, and I thought I broke my jaw. And
Wow.
This was in November. And then with being married, changing insurance, paperwork, wait time, she finally got in to a doctor and then scheduled the MRI. And then
Okay.
he said, you have a C4 slip disc.
Okay.
And then it took a while. And so, you know, they aren't telling her anything other than, well, now you should do some physical therapy and
Okay.
live with this, or we'll maybe consult an orthopedic surgeon and see how things go. So,
Okay. Well, she should consult an orthopedic surgeon if she's having a problem. A consult from everywhere is a good thing. Then you put it all together and figure out what you want to do. What are her symptoms right now, though, Greg?
well, you know, she described, well, she's in constant pain, lots of
Okay.
Advil. And, you know, she said, Dad, it feels like bone on bone, just a weird sensation. She feels best when she's laying down.
Okay.
And, you know, she works and has to be on her feet. And,
Okay. So,
yeah.
am I getting this right that she's having a lot of neck pain?
yeah, neck pain
Okay.
all across her shoulders.
Okay.
She doesn't have any numbness
Okay.
in her fingers. You know, that's what everybody asked right away. You know, she's been to the chiropractor, does some massage.
Okay. So let me give you my 2 cents on this. You ready?
Yeah.
Your daughter has mainly a sprain in the ligaments in her neck and across her shoulders, which would be things like the levator scapula muscles that go from the scapula to the C2 area of the neck, and the maybe the rhomboids, the supraspinatus. There's a bunch of muscles around there, and I will bet you anything. I can't promise because I haven't touched the area yet. I'll bet you anything it's not a slip disc that's causing her problem. I'll bet you anything it's a sprain. And I always tell people, they come and they go, I have to get a surgery. I've got slip discs that are, and I touch them and I go, you don't. Anyway, we're going to the end of the show here. So why don't you do this? Why don't you send me an email through the website? And Joe, you do that too. You're waiting. You have a question about platelets. The website is www.jointrehab.com. And put your phone number in there and I'll call you right back today. God bless you all. Thank you. And thank you, Nita Valens. You're a great host.
Thank you, Spencer and Suzette. See you next time.
You've been listening to Living Pain Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain-Free with Dr. Marc Darrow is heard Saturdays at 10 a.m. and 1 p.m. and Sundays at 5 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, call to schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.